Good evening, I'm Barkha. Dutt. You're watching The Mojo Story, our independent digital platform that does a deep dive into the big stories of the day. Are we looking at a second wave of the COVID-19 pandemic? Almost everybody agrees that we are. What people don't agree on is what should happen next. Should the focus be on opening up the vaccination program, or should states be re-looking at a lockdown or some version of it? Personally, I'm no fan of the latter, and many are arguing that lockdowns are a bad idea. The focus needs to be elsewhere, given what we've learned from the year 2020. Before we introduce our panel of experts, let's look at what the latest numbers look like. We have seen, if we can bring up the opening slides now, we have seen over 34,000 active cases as on 23rd March 2021, over 40,000 cases, of which 5,277 are active cases. Now, this is very distinctly a surge, but a majority of these cases, in fact, over 60% are coming from Maharashtra. At the same time, we are also seeing an increase in the vaccination doses, and you are seeing there what the numbers look like again for the 23rd of March or 2021. So you're seeing both things happen actually simultaneously. You're seeing an increase in the number of vaccination doses, and you're also seeing a number of active cases going up. The highest single day vaccinations have in fact been recorded on the same day as we saw that surge in active number of COVID cases, which really brings us to the key question: should the emphasis be on universalizing the vaccination program, or should it be in fact on getting alarmed by the number of rising COVID cases? Remember that the CFR, the case fatality rate, which is how many people are dying quite simply, still remains below 200, quite low compared to other countries in the world. The United States, for example, is more than 3 times the fatality rate of India. So to talk about what should happen next, let me introduce our panel on the program today. Let me introduce our guests one by one. We are joined by Dr. Swapneil Pareikh, who's of course a physician and an author. Welcome, Swapneil. Welcome back to our platform. We're joined by Dr. Muffazal Lakdawala, who has spent pretty much most of the year at the front line of the COVID battle, as has Dr. Gautam Bhansali, well-known doctor. All three of you are in Mumbai. There's a reason that I put together a panel of Mumbai doctors, because I think the story is in Maharashtra, which, as I said, accounts for over 60%, 61%, in fact, to be precise, of the positive cases in the country today. So I'll start with you, Mufi, if I may, because I think, opinion is divided on what should happen next. There is one thing called mask up and live, right? And there's another thing, which a lot of people are talking about, which is re-looking at the possibility of a lockdown. When you have to look at this data, how do you analyze it?
It's a huge dilemma that the powers that be will be under, because we do know that lockdowns, to a certain extent, do help in trying to get people off the roads, and so that people don't get in contact with one another. And we know this is a communicable disease. But at the same time, we must understand that people have now reached a point of corona fatigue. People do not have the bandwidth to withstand another lockdown. Economy cannot withstand another lockdown. So I believe we have to start to learn how to live with the coronavirus. And once we start learning how to live with the coronavirus, the only and simple thing is protect yourself. How would you do it? Mask up at all points of time, keep social distancing, and sanitize your hands. So 3 simple basic ways of preventing it. Of course, Maharashtra, being the state having the largest numbers right from the beginning, already has a large section of people who are probably immunized because they've already had the virus and developed antibodies. Along with that, Barkha, like you said correctly, 60% of the vaccinations are happening in Maharashtra. So that's again where we are going correct. We are doing as many vaccinations as we can. So if we mix the two, immunization because of vaccination and immunization because of previous infection, then we are coming very, very close to some form of immunity, at least for our section of the population.
So, Mufi, the important point that you make, apart from the COVID fatigue, is also about the efficacy or the efficiency of lockdowns. Now, one of the things that reporting from across India taught me about the lockdown is it was meant to prepare the health system. It was not meant to be a preventive or a long-term preventive against COVID. Yet we see even Maharashtra politicians today saying if the numbers surge, we'll have to consider localized lockdowns. And much of the Western world is gripped by this paranoia. They seem to keep going back to lockdowns. If you were to explain very simply to our viewers why lockdowns are a bad idea, what would you say?
I think lockdowns were a good idea when it started because we wanted to shut down people and we wanted to tell people that we are getting ready for a big, big wave, which luckily at that point of time, we didn't know what would the case fatality rate be. We didn't know how infective this virus would be. Today, we know that the case fatality rate, like you said, Barkha, is very, very low. Yeah, it's around 2.15% in Mumbai or in Maharashtra, and around 3% in Mumbai, and any major city would have a higher fatality rate as compared to the whole state, because most of the serious patients go into those or gravitate towards the states. But right now, our economy will get hit. We do not have the bandwidth to take another lockdown. And I think it's futile to have another lockdown. Yes, during a festival, maybe you can do mini lockdowns. So you shut it down around the festival so that people don't go and socialize, just like, for example, Holi is coming around the corner or Kumbh Mela. You will have to shut it down because there are massive amounts of people there. And I think it makes sense to shut it down during that period. But that should be what a lockdown should be for now. Otherwise, I don't think it makes sense at all.
Well, there's no lockdown happening for elections and election rallies, so I think that's the irony. But Swapneil, I want to bring in a contrasting view from you because I've been reading your tweets and you and I have argued about this often. You actually think that those who said that India had actually turned the curve, were wrong. It was premature. The worst is not necessarily over. And your tweets seem to be a kind of doomsday prophecy. And my question to you would be, let's say that there's a terrible second wave coming, right? Do you think or don't you think it's wrong to keep counting the numbers of those who test positive? And actually what we should be counting is mortality. And if mortality continues to remain below 200, which is where it's at in the last 24 hours, 199, then we cannot panic. We cannot shut down this country again.
So Barkha, first, I apologize. I never mean to be a doomsday prophet, but I think what we need to explain is there is a huge difference between saying we need to be prepared and maybe over-respond to prevent a worst-case scenario and saying that we are definitely heading there. Let me contextualize the numbers. So let me start by saying we're dealing with the fastest ever increase in cases in the history, the rate of increase of cases in the history of India's pandemic, in the context of the highest number of people in our history who have already been infected and recovered. I think that's key. Let's take Nagpur, for example. Over 3,000 confirmed cases per day. We know that we only detect about 10%. So it's safe. A safe undercount would be 30,000 new infections per day. In a city that has a population of 3 million people, that's 1 in 100. This is in the context of sero studies that have shown between 50 to 75% exposure in parts of the city. Mm-hmm. That should set alarm bells, especially when you add in the mathematics of exponential growth. To step away from that a little, I think what we need to consider is when we talk about lockdowns, I don't like talking about lockdowns. I think as a personal privilege, it's just, it makes me feel uncomfortable to talk about something that's not going to impact me very hard. What I will suggest is we need to start preparing for the possibility of a lockdown. Because if we are going to head towards a lockdown, it will be unforgivable if this time again we let people starve, if we let migrant laborers be stranded. We should prepare for the possibility, of course, do everything we can to avoid going there.
Why are you still open to the idea of a lockdown instead of talking about let's vaccinate everybody in Maharashtra above 18? Right? We know Maharashtra accounts for 62% of the positive cases in India, or 40,000 positive cases. I think 30,000 have come from Maharashtra. Why are we talking about a theoretical possibility of a lockdown instead of saying above 18, walk in and get your vaccine? And by the way, they finally opened it up for people above 45, so I can finally get my shot. But go ahead.
I'm not saying that we should do a lockdown. Let me clarify. What I'm saying is just like we prepare for a worst case scenario everywhere, we should be prepared for that possibility so that if it happens, people don't suffer. Let's get to the mortalities. We know very clearly now through this pandemic and in multiple countries that there is a time lag between new infections and mortalities. Today's infections will result in confirmed cases in a few days to a week. A few days to a week from there, that will lead to hospitalization. And 3 to 8 weeks after we start seeing increase in transmission, we start seeing an increase in mortalities. The problem is if you start reacting once we get to 1,000+ mortalities a day, it's too late. I don't advocate lockdowns, but what I will say is that they are a blunt but effective method of temporary intensive physical distancing and infection control. They're never meant to be permanent. They're not only meant to prepare the healthcare system, they're also meant to protect the healthcare system from getting overwhelmed.
Okay. Let me just get Gautam Bhansali now with his view. What do you think, sir? You've had two very different perspectives there. And I mean, I have to personally lean against lockdowns is something I feel quite strongly about. I also think in a country like ours, not everybody is safe staying at home. You have millions of people who stay 8 people to a room. So stay at home means very little to the poor. Also, this virus is going to keep mutating. Today we have Punjab, for example, sounding the alarm on more than 80% of its cases having what's called the UK variant. But a virus can mutate for the next 5 years. So every time are we going to look at a mutation and say, oh, maybe the vaccine is not effective again? Like, how are we going to live like this? How long can we live like this? Sorry, sir. Let me just unmute you. Go ahead.
Yeah, Barkha, yeah. If you really analyze all the data and if you see that UK, US, Europe, all these countries are 3 months ahead of our country. Like when you see the first wave, that time they were 3 months ahead to our country. Then cases came to that Kerala, Maharashtra, and rest of the country. Same thing happening now. We were very much happy that UK and US are not able to control COVID virus, but we have controlled very well. But no, after 2.5 and 3 months of that UK and US cases, our country is having now a lot of cases. Started with Kerala, then Maharashtra, now it goes to all rest of the country. We have to accept that this is a second wave. It's not only surge. Second thing, every day in Mumbai, now we are planning to increase number of testing. In the month of August, September, October, when there was a first peak, that time we were doing 12,000, 14,000 or maximum 15,000 testing. Now, till yesterday, we were doing 25,000 testing, and from today or tomorrow onwards, our planning is to increase number of testing up to 50,000 per day testing. So the number of cases will definitely increase. It may go up to 5,000, 6,000 or 7,000. Now the thing is lockdown, I feel this stage is not feasible and is not going to help us much. Why? That time lockdown was required because that time we were not prepared for this COVID, not prepared for this pandemic, because that time we were not having infrastructure, we were not having medications. Even our doctors were also not aware about this disease. What to give, when to give, what medications or oxygen requirement is there or ventilator requirement is there or not. That time we were not educated. Even people were also not educated. So that time lockdown was required for the infrastructure point of view, to educate people, to give awareness about all these things. Now all things are in place. We have enough bed capacity. We have all medications. Doctors are very well educated. Patient is also very well educated. Each and every patient nowadays, even in periphery, they knows what is pulse oximeter, what is oxygen saturation, when to go to doctor. Everybody is aware about that thing. So now this time only we need 4 things. One is like SMS, sanitizer, mask, and social distancing. And fourth is vaccination. We demanded this to government of India that we should do surgical strike of vaccination. There should be mass vaccination. We are having this vaccine diplomacy. We are exporting vaccine to other country. Why we are not having this policy like US, that first we will vaccinate our country, our people, and then we will give vaccine to other country. And you see that we are vaccinating till now more than 45 with comorbid and more than 60 plus. But if you see closely, people who are between age of 20 to 45 or 40, they are most mobile people. They are the one who is spreading this virus. We have to vaccinate them. So we should do surgical strike or mass vaccination of this vaccine. That is the only way to curb this.
I have to say I agree with you, and thankfully the government has said from the 1st of April, if you're above 45, you don't need a comorbidity anymore. You can go and get vaccinated. But Mufi, I want to come back to a point that Gautam made, and I think that's the correct point, that doctors today in India, and all 3 of you have worked at the front line, know how to treat patients with COVID. So do you think, one, that we are pressing the panic button when we talk about a second wave? Should we be calling it a second wave? Secondly, even if it's a second wave, how do you get to the point where testing positive is not a big deal? I think that's the question I want to ask. Do we need to be terrified about testing positive, especially when the serological surveys show us that 30 times the official numbers, at least, of Indians who are believed to have COVID have had COVID and not even known that they've had COVID?
Yeah, so it's a great thing to say that you should not be scared. The stigma, the fear associated with this virus has completely gone away, because we've got everybody around us who become COVID positive, and that's why they've recovered. So the recovery rates are as high as 95%, for example, in India. But that's where the COVID complacency has set in, and that's my big fear, that people have stopped getting scared of COVID. Unfortunately, somewhere someone is dying of COVID, and that's not correct. We do not know who, we cannot predict who. So none of us know how to treat it, because there's no treatment yet for this virus. We can only predict that we'll give this form of therapy or that form of therapy. We started with tocilizumab and remdesivir, which we thought was the great tool that would save us. Of course, we've been proven wrong. We've gone on to giving basic drugs like, for example, doxycycline and ivermectin and various other things. And we know that that's not even being treated for in the US or in European countries. So I believe that genetically we've been exposed to some form of coronavirus over a period of time. In India, we have a lot of influenza and chest and pneumonia type of infections. So I think they've isolated 13 or 15 types of coronaviruses. So somewhere we've got some form of innate immunity, I believe, which has made us slightly more resistant to this virus. And that's why I believe our case fatality is low. Having said that, that does not take away from the fact this is still fatal. In India today, we have more people dying of tuberculosis than of coronavirus. But the myth and the fear around the virus is very difficult to take away from public mind for now.
But what do the serological surveys? Don't the serological surveys tell us something that should make us reimagine the efficiency of lockdowns? First to you, Mufi, and the same to Swapneil.
I believe that lockdowns were meant for a purpose. They've lived their time. I don't think they have any value any longer. We've argued about this previously, Barkha, about schools and various other things. Schools still remain closed. Yeah. Well, kids do transmit this virus. Though they don't get affected themselves, they probably kill their grandparents because of the virus they might pick up. So I think you have your pros and cons with schools opening or not. However, I do believe lockdowns have lived their time and should not be done unless it's for a specific period like a festival. Because we believe, like I said, there's no more corona fear. There's complete corona complacency. And that's why we don't have masks. We believe that even if we have masks, we need to wear them around our neck rather than on our nose. So that's where I am coming from, that given that mindset of Indians, that's why it's important to have lockdowns during festivals.
Okay, so short, limited bursts of lockdowns. I think Germany, for example, is locking down for Easter, just to give an example. But Swapneil, we don't want to go the way of the paranoid West. Admittedly, their fatalities are much higher. The United States, as I was saying, is 3.5 times the number of India in terms of how many people are dying. Brazil is about twice the number of deaths. But I would even argue with Western countries, how long are you going to keep your economy, your society shut? And you're seeing now anti-lockdown protesters take to the streets of cities like London saying, we cannot live like this anymore. And the human instinct, cannot accept this. And for example, there's so much confusion in the science. AstraZeneca in the United States just got a clearance to say no blood clots, and then you have a new report in the New York Times saying, oh, hang on, maybe that that data wasn't completely updated. So for the regular Jane and Joe, this is an impossible way to live.
So let me just step back a little. First, let me give you some information about what we're dealing with, and then let's talk about the solutions, many of which the other guests have already mentioned. So the first is we know we are dealing with increased transmissibility. Based on the R. We don't know if we're dealing with possible immune escape. So we need to understand that. The only way you can do that is with genomic epidemiology. With the lineage that was identified in UK, the variant of concern B117, we know three very concerning things about it. The first is it is more contagious. The second, people infected with it stay contagious for longer. And the third, we don't know this, but there's good data to suggest it, that it causes more severe illness and has a higher fatality rate. That is what we are dealing with. Even if we weren't dealing with a higher fatality rate, when you're dealing with something that's more transmissible and causes more cases, if it overwhelms our capacity to care for the infected, it will increase fatality rate. Now let's talk about the solutions. We've talked about scaling vaccinations, but that's only one part of the solution. Why is that only one part of the solution? Because if we start vaccinating people today, they will only start having protection 3 weeks from now. They will only be fully protected 2 weeks after their second dose. As soon as we start scaling our vaccinations to 5, 6, 7 million per day, you multiply that by 30 days, we don't have the manufacturing capacity to meet that. So what do we need to do when we say scale vaccinations? Of course, we scale vaccinations, but we also have to scale manufacturing. What are the bottlenecks in manufacturing? We really need to re-examine our price controls. Have these price controls, do they mean that the manufacturers aren't able to procure raw materials internationally because there's global demand? Vaccine manufacturing equipment because there's global demand? Do we need to incentivize them to be able to double, triple their manufacturing capacity? Should we procure larger orders instead of procuring 10, 20 million? Should we be procuring 200 million, 1 billion doses at a time? So they're capitalized. And then the thing that really gets to me is we have one of the most effective and safest vaccines that has been tested in several countries, being produced in India, projected that there will be 1 billion doses of Covovax produced in India. And for whatever reason, we're not rolling that out in restricted EUA and clinical trial mode. To give you an analogy, when your house is on fire and you have some of the best fire extinguishers in the world that have been tested in several other countries, do you say that, oh, but fire extinguisher not tested in India? The unique advantages of Covovax is that it has a very high efficacy, possibly higher than, difficult to compare, but possibly higher than the mRNA vaccines. The interval between the doses is 3 weeks, so it gets us to full immunity faster. It's the only vaccine in animal studies that has been shown to provide sterilizing immunity. There are some unique advantages to this shot. We really need to accelerate all the vaccines that we have and scale manufacturing, not just scale distribution. And let me clarify, I'm only saying, like we prepare for earthquakes, like we are supposed to prepare for pandemics, prepare for a lockdown, because if we don't and it happens, that means people will be stranded and they will be starving. Prepare for it. I'm not advocating for it. I'm advocating to mitigate against the secondary order effects of it.
Okay, I think you raise a couple of very important points. One, a vaccine that you think needs to be rolled out and is being stalled, but vaccine pricing. Dr. Gautam Bhansali, the vaccine manufacturers are not speaking about this openly, but others have. 250 rupees a pop basically means 100 rupees to the hospital, 150 to the manufacturer. I will say to Swapneil's point, though, that at the moment we're vaccinating under the capacity of our production. So if we have about a 5 million capacity, we're not, Swapneil, vaccinating at that level yet. We're still seeing vaccines go waste. We're still seeing vaccine hesitation. And I think that if we open up for the working population and for the 30 to 58 group, you will see a surge in those vaccines. But Gautam, do you want to come in on Swapneil's point that our capacity and our pricing simply cannot keep pace if we were to universalize or scale up the vaccination program? And so that has limited value right now.
Yeah, Barkha, I strongly believe that we should scale up that our vaccination program. And as far as rate and that manufacturing thing is concerned, why not we should also allow that companies to distribute to the medical counter and all these places, and person who is go and they can take vaccine and get it done. Like if you see in the US, then person who is driving and somebody come, they will give vaccine and there is no side effect, nothing is there. Even in our country, more than 5 crore people are vaccinated till today, and not a single person is collapsed or not a single person died because of vaccine only. So we should, if we want to speed up this program, if we want to scale up this program, then we have to go to housing society, we have to involve NGOs, and we need to increase this vaccination program. This is the only way to curb this second wave. Otherwise, there is no other way. And as far as rate is concerned, I think now we can give liberty to the manufacturing companies that whatever rate they want to charge, they can charge, and person can go if they can afford. For the BPL people or poverty line, below poverty line people, they can go to government hospital, they can get vaccinated. I think money is not the issue at this point at all, and they should not be in loss. So I feel we should speed up this vaccination program by giving liberty to the manufacturing companies, because
To
raw
set their
material
own
is
prices.
definitely,
Yeah.
yeah, that raw material
Basically,
is
in private
definitely
centers, let vaccine manufacturers set their own prices, let them be free or capped at government centers. But Mufi, the
yes,
mismatch between demand and supply, I think, is the point that Swapneil is really making. That it's very easy for people like us to say, don't focus on lockdowns, focus on vaccines, but it's not a realistic situation. Could this change in the next 2 months? There are a number of vaccines that we haven't considered. There's the Sputnik, there's the Johnson and Johnson. Pfizer couldn't get into India because India asked for local trials, and then of course, there's Swapnil saying that the best vaccine is still waiting for a rollout. Go ahead, your thoughts, Mufi.
I think that what Swapnil said is quite correct. We need to roll out almost all vaccines. The GCI has not given approval, I believe, for Covax yet to be rolled out in India. We've had, I think, political reasons for various reasons, all vaccines not to be rolled out. Probably we are waiting for all the stock to be used up. And if you see lately that the Director of Health has come out with guidelines saying that Covishield, which was the first vaccine to be used in India, in the beginning, and everyone was going for Covishield compared to the Covaxin, has now got delivery supply problems. And that's why
Yeah.
I believe that they are saying 6 to 8 weeks later rather than the 4-week period. Whereas that's not true with the Covaxin, because it's only India that is asking for this vaccine today. We've supplied a little bit to a few countries, but Covishield has to be supplied even to the UK. And UK, we've read in the newspapers that they're waiting for more doses to be supplied by Serum Institute, and they've not been supplied. So I think somewhere there is political pressure as well for the reason for delay for 6 to 8 weeks, rather than just being health grounds why we are delaying
So you think the change in the gap between dose 1 of Covishield and dose 2 is political and not medical?
I think there are more political reasons than medical reasons for that.
That's interesting. Swapnil, last thoughts? Sorry. You're on mute. Yeah. Go ahead. Yeah.
The increase in the gap between the doses definitely seems to be to meet the supply. And there have been modeling studies that have shown that by delaying the second dose, you can actually save some 15 to 20% more lives. So that's not necessarily a bad thing to do. But we also do need to aggressively, this is the really important thing we need to realize. We start vaccinating today. And we're not just talking about vaccinating, we need to scale production, everything starting. If we start today, the first people who get vaccinated today will have some protection 3 weeks from now. They will be fully protected 2 weeks after their second dose. So we need to understand that you can't over depend on any one layer of pandemic response. You need to put multiple layers together, because vaccines aren't going to cover us right away. And we urgently need to roll out these additional vaccines. The government needs emergency use authorization is for emergencies. There is a law in the book that says a vaccine that has demonstrated remarkable efficacy can be rolled out. So we need to do this because it's the one vaccine that has capacity, it has a safe adverse effect profile in trials, and it has high efficacy. Three weeks between doses is critical right now, because that means in 5 weeks people are fully protected, and we obviously need more vaccines.
I'll talk in the end a little bit about mutations and variants, right? Because, for example, what you're seeing the West do, for example, the United Kingdom had a calendar to open the country, and now there's pressure saying there might be new mutations. Even if we open up domestically, we won't open up for travel. Many countries are choosing to close their borders. Others are talking about vaccine passports. I just want to focus a little bit on the psychological dimension of this. I personally just don't see it feasible for the world to remain closed any longer. And just like we developed a capacity to live with SARS, I think Mufi made this point in the beginning that we've got to learn to live with COVID. Do you three think that we are at that point now, that we need to learn to live with COVID? Gautam, I'll start with you.
Yes, definitely, Barkha. I think we have to live with this COVID only. And with this COVID, we have to follow the 4-point: sanitizer, mask, the social distancing, and the vaccination. That's it. And we have to live with this COVID. There's no point again going for the lockdown and putting economy in that problem, especially making people in a big depression. See, in one last year, people are in their house and they are really in big depression. If they meet in that wedding and all the things, they meet like that. They see people after a year or so, like so. So I feel better we should live with this COVID only. And we should not go behind this number game that today number of cases increased to 4,000, 5,000. There is no point. See, if you are still counting that India is having 2 crore or 2 lakhs cases of COVID is there, people are already recovered from COVID and still they are in counting. So I feel there is no point counting this number, no point going behind this number game. You should do testing, and vaccine. That is the only way.
Let me put this to Swapneil, because Swapneil, the point is we don't count our other infectious diseases the way we count COVID, yes. Right? And I think given the fatality rate, at least in India, we have to examine why we're so obsessed with counting those testing positive. I still understand counting the death rates every day. I'd be more comfortable with that. I'm not saying it's okay for 200 people to die every day, but the fact is that 3,000 die from TB every day, and we don't get as obsessed about tuberculosis.
I 100% agree with you that we need to focus on tuberculosis as much. It's going to be around for much longer. Keep in mind that whatever capacities we build for a viral respiratory pathogen that has caused a pandemic will also allow us to accelerate towards our elimination of tuberculosis by 2025 goal. But let me just say this, we're talking about this, saying we need to learn to live with numbers and the mortalities are low. Let me reiterate this again. There is a time lag between where today's infections become future mortalities. The individuals getting infected today, the 40,000 that we are talking about today, none of them are going to die today. They are going to die 3 to 8 weeks from now. So if we contextualize 40,000 infections today and say that there are only 200 fatalities today, you're not accounting for the fact that most of the people infected today aren't going to die today. And if you start to respond only later, then saying that only 200 fatalities will be famous last words.
Yeah, but the flip side would be that the sero surveys, Mufi, do tell you, at least done in the major cities like Delhi, Mumbai, Pune, that at least, anywhere between 30 to 50% of our cities have had asymptomatic cases of COVID. So forget dying, you don't even get the symptoms. So this can be argued both ways, right? And as persuasively. So have we reached that point where we've just, as Gautam is arguing, we have to stop obsessing about the numbers, or is that a kind of complacency we can't afford?
No, I think we have to stop obsessing. I think we have to start learning how to live with COVID. Our case fatality rate, whatever anybody would tell me, I would be really surprised if that would go up, even some time from now. What I would more worry about is, and that's why I believe that vaccinations need to come in soon and fast, is because they prevent severe form of COVID. Right? They don't prevent you probably from getting COVID, but prevent a severe form of COVID. So it prolonged, like long COVID, which gives you more long-lasting symptoms and cripples you on the lung front and breathing front for a very long time. And we do know that there are neurological problems and various other things that come with long COVID. If it prevents long COVID, then vaccinations are a must, and that's what is needed for. We're not going to get rid of COVID. I'm telling you, 10 years from now, we'll still be talking about COVID. So start learning how to live with COVID. Let's open up our cities. Let's open up our countries with precaution. But at the same time, we need to open it up.
I think that's the last word we can all agree with. Swapneil has some misgivings, but we'll keep a close eye on where these cases go from here and bring all of you back. Thank you, Gautam, Mufi, and Swapneil. And to our audience, if you are above 45, go and get that vaccine. I'm certainly going to do it. At 49, I was just below the threshold of eligibility, but I've reached there, and I'm going to get my shot soon. Thank you, guys, and see you soon again. Thank you, and stay safe. Bye-bye.
Thank you.
Bye-bye.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.